Good morning and welcome to Super Healthy Super Mornings with Dr. Shilpi. So, it's all about normal deliveries, it's all about encouraging women to have a vaginal delivery, it's all about creating an environment for normalcy, it's all about going surgical free. And now, with this ambition and with this motive in your brain, I started I started these sessions for encouraging normal vaginal delivery this month, and the month is coming to an end. But there are several topics to discuss, and these topics will go on and on and on. So today I wanted to discuss something very important. That's about when actually the delivery happens. These days what is happening is there is a lot of stiffness in the woman, especially when they don't sit down and they don't do their daily chores. There are so many mechanical things that are assisting them, and there is so much of lack of pelvic exercises, and the normalcy and natural habitat has been taken away. There is no squatting, there is no sitting down and doing chores like maybe washing clothes or cleaning vessels and all these things. And women are not experiencing that perineal stretch, and the perineum has become very tight. What is perineum? Perineum actually is the part between the vagina and the anal canal. That is the area between the vaginal opening and the anus. That is the motion area. So that part, which is supposed to be very soft and very amicable to labor and delivery, maybe because of rigidity also, and nowadays people are not even sexually active that easily, and they have their own constraints, they have their own timings, they have their own notions and preset lot of prejudices and all these things. And when they are not even sexually active, the perineum, which is supposed to be very soft and very very amicable to stretch, has become very hard. And now because of the thickness and the hardness and the tightness of the perineum and the perineal muscles, especially during labor and delivery, when the head has to be delivered, what is happening is we have to resort to an episiotomy or cutting or tearing or spontaneous delivery of the head with giving away of the perineum here and there. And now this is called a perineal tear. So how do we prevent these perineal tears? Is by preparing the perineum. Okay, so there are several massages to prepare your body in terms of stress relief, relaxation, and all these. We had one session on the go when I was traveling in the car that day about massages which give relaxation to the body and muscles. Similarly, perineal massages are the ones that give help for improving the blood supply, improving the malleability, improving the texture of the perineum, that actually has to distend and open and give way for the head to deliver. And now when the perineum is hard and thick and it is very tough, the head at the point of delivery, when the delivery has to happen, sees this kind of an obstructing muscular thick hard perineum, not allowing it to enter. And this is the time when we as doctors take consent and give an incision into the perineum, so that there is a tailor made cut that is made, so that the perineum opens in a particular fashion which we can easily repair later and deliver the head. And now this perineal cut, at times it is on the left side, at times it is on the right side, at times it is on the midline. And some people do often, they have their own fixed notions, and they ask us not to cut the perineum and let the perineum give way and tear, and then the baby delivers. And after the baby delivery happens, we actually repair the perineum. And this is what used to happen in the olden days also. But there's such a lot of difference between olden days and nowadays. Olden days, the daily activities and everything was so high that the perineum used to be very yielding, and it used to be very soft, and it used to be easily giving way for the delivery to happen. But nowadays we have very thick, hard, tough perineums to handle, and that is why a concept of perineal massage has come in. And when we talk about perineal massages, it's about improving the texture of the thickness of that area, and improving the elasticity of that area, and improving the blood supply to that area, so that when in labor and delivery, it gives way very easily, and it allows the head to deliver without a cut, or at times with a minimal tear. And we prepare these perineums in such a way that it helps us in the delivery process. Why we do this? We do this to avoid episiotomies, to avoid any kind of trauma, to avoid larger scale injuries, and to avoid episiotomies. And what do we have to do for this? For the perineal massages, we actually start the perineal massages, say about 34 weeks of pregnancy. That is, once the 8th month is coming to an end, we usually start these massages. And then with a natural lubricant. Okay, natural lubricant means the natural oils we can use, like the coconut oil, or the sesame oil, or the olive oil, or any natural available oils, and not synthetic and mineral oils. With the natural available cold press oils, we can do this perineal massage. Or if you want to be very safe and do not use any oil, or if any oil gives you a lot of discomfort, you can use the KY jelly that is available over the counter. It's quite sterile also, and this is used for gently massaging the area. And now, how often do we have to use this? Is, say, some people do it daily. Initially it is cumbersome, it can cause little burning, it can cause little bit of pain and irritation and all that. But once you start doing it on a regular basis, it gives you it does not give you that much of a problem. And usually there are people who do it on a daily basis. At least on an alternate day, if you do, the perineum becomes much more softer and accessible and easy on when it is required during labor and delivery. And so, how do we do it? First and foremost thing is definitely to wash your hands. And this perineal massage can be done by the patient herself, or the partner, or anybody whom she directs them to do. And after washing the hands properly, then you can take the oil, the natural oil, or the KY jelly. And you should not use any mineral oils or petroleum jelly and all these things. They are not to be used in the perineal area. And once it is applied to the fingers, you have to sit with your legs wide, and maybe a mirror will help you in the front if it is possible. And gently with the fingers, you have to enter into the vagina, say about 1 or 2 inches into the vagina. And then if you have to look into the clockwise, you have to actually massage the area between the 3 o'clock, 6 o'clock and the 9 o'clock area. So 3, 6 and 9 o'clock area is the perineal area. So that area you have to gently massage and improve the blood supply. Maybe you can do this for about 2 to 5 minutes on a regular basis, if possible daily, otherwise at least alternate day. And by massaging this area, you improve the texture of the area, you improve the elasticity of the area, and you actually promote stretching of the area, because you are gently massaging and stretching the area with your fingers, with the thumb and the finger, on a regular basis, from the 3 o'clock, 6 o'clock and the 9 o'clock position, in a phased manner, so that the perineum is actually massaged this way. And when we do perineal massages on a regular way with a lubricant or natural oil, it actually improves the blood supply. It actually improves the malleability of the tissue. And when in labor, what happens is when the head comes and crowns on the perineum, it actually gives way to the head without actually cutting it, or without actually even tearing that very much. So this is all about practices that used to happen, and even now in birth education classes, we usually tell them about these procedures and these things, and they are the ones that actually they look very silly, very small, but then the actual benefit has been seen when people actually do them, and then in labor we see that texture difference of the perineum. And nowadays it is becoming very difficult because we have very thick unyielding perineal muscles which are tight and taut, and people haven't done any exercises, or neither sitting nor butterfly squats, or any kind of squats, or any kind of preparation that they have done to the perineum, because of which the perineum has become tight and rigid and very, very hard. So if we can do this perineal massage from say about 34 weeks, or the mid of 8th month, or the end of 8th month actually, and continue it till labor and delivery on a regular basis, it definitely helps. And whenever these kind of perineal massages are done, it also encourages preparing you mentally for a normal vaginal delivery. Not only this, if it is done by your partner, it encourages bonding, it encourages involvement in the pregnancy, and it also helps during labor and delivery. So this is all about perineal massages, and how perineal massage can prevent a traumatic delivery, can prepare your perineum for the day of delivery, and how perineal massages can help deliver the head of the baby easily without causing much trauma, and without causing any kind of a much bigger tears and larger episiotomies. So these small things in pregnancy and during your pregnancy define how healthy and how easily you deliver in your labor. So this is all about perineal massages, and today's 29th, and maybe it's 4-5 days to Diwali, and tomorrow onwards we will talk about what actually you need to take care in pregnancy and Diwali. So let's do 4 or 5 classes till Diwali happens, and after Diwali we can definitely resume the normal regular classes for encouraging normal vaginal delivery. So tomorrow morning we will have a session on how to enjoy festivities with pregnancy, and how to be careful about eating or sleeping or taking rest or activities or parties or whatever. So tomorrow's topic is this, and thank you all for joining, and see you in another session tomorrow morning, live 7:30.